I'm Dr. Mark Niederee, general surgeon with Wichita Surgical Specialists. I went to high school in Great Bend, Kansas. I was the youngest of 5 boys. Then I went on to college at Wichita State University, followed by medical school at KU School of Medicine. I chose medicine because I really enjoyed math and science, and still I like to do things with my hands. So I was drawn to medicine also. It's kind of a family tradition. My dad was a surgeon. One of my brothers is a family doctor. My ultimate goal as a surgeon is to try to get the patient back in the quickest, easiest, and most pain-free process possible to facilitate them getting back to work or their activities of daily living. You know, there's hundreds of patient stories, and I'll start off by explaining that probably 5 years ago, in my private office within our office, I moved all my degrees and all my awards and all those things home to my home office to motivate my kids. Because I don't think patients really care that you have all these degrees hanging on the wall. And in their place of that, I started putting thank you notes I received from patients and families. And you know, it never felt like it was that many, but over a few months and then a couple years, and now I've got a covered wall. And it's humbling to walk in there and see that. Outside of practicing, I enjoy spending time with my family. My children are all runners, so I go to a lot of track meets, both cross country and regular track. Those can be long days at a track meet, but it's enjoyable watching them achieve and improve. Really, it's a blessing to be able to watch your kids grow up and how they experience life and move through the various stages. Yeah, I often get that question about, you know, what advice would I give someone, a younger person interested in medical school or possibly even surgery? And I think medicine and science are important. I think a desire to help others is important, but surgeons work long hours and we're called in late at night, and it can be a very tiring profession. So I think you really have to feel a calling that you're ready to give more of yourself. And that sacrifice doesn't just involve you as the surgeon, but it involves your whole family. Given all that, 100 times over, I'd still choose medicine.